Hi, we're here today with Kevin Kuehmeier, who is a senior associate at Justice System Partners. Kevin, thank you for joining me today. Really appreciate you taking the time to share your information with us. Can you just start a little bit by telling me about your experience in this area?
Sure. Well, thanks, Jen, for having me, and thank you to all the people that are participating in this. My background, I've been with JSP for 3 years and been doing technical assistance in the criminal justice arena. But prior to that, I worked for 25 years in the federal probation and pretrial system, and within that, within my years of experience, the first half of my career, I was a federal probation and pretrial officer, and then I eventually became a specialist that handled cases that were involving people with substance abuse disorders. And so I was they called it a drug and alcohol treatment specialist. So worked with that population for a significant amount of time. Then I went to our headquarters and then worked on um, programming in relation to national treatment services and providing some guidance for our system regarding contracting and programming, and also was involved with training in that arena. So
Excellent, thank you. So I know we're going to talk a bit today about the engagement of clients. And so can you describe a little bit of the work you've done in your various roles when it comes to engaging clients and especially around this idea maybe of MOUD?
sure. And that engaging clients is a interesting term, especially in the criminal justice world, right? The people that I supervised were not there voluntarily, right? I mean, they were either charged or convicted of a crime, and then they either came into the system because their substance abuse disorder brought them there, or maybe the offense that they were involved with had some interaction there. But ultimately, the cases that I was involved with, had this disorder or substance abuse disorder that they were trying to working through, and the engagement issue was always a challenge for sure. Um, so, we of course, on the front end of the system, if it was a pretrial related individual, a lot of times that was very difficult, because if they hadn't had any prior criminal justice experience, I was the first face for them,
Mhm.
and and it was difficult then for me to say, okay, we've got to deal with you while you're out on bail, but also now dealing with issues that are related to their substance use. And then on the other end, it's when they're coming out and maybe they've been in a facility for a while, and how do you then deal with that and that addiction that they might have had, and then this handoff between obviously specific, I dealt with all different types of substance abuse, but certainly with MOUD and how heavily addictive that was. It was it was a process to work on this engagement piece.
Great. And so as you were doing this work, what, if any, challenges did you experience when doing it?
Oh, there were no challenges.
It all went smoothly, right?
Yeah, all went smoothly. Well, like I said earlier, that the fact that you know that that individuals were there involuntarily, right, was a challenge, and I'd say there was motivation for sure, issues, and were these individuals willing to change or not, right? So I felt like that was a big challenge, and what you had was, you had people at different levels of addiction, right? So we had, it's everybody's different when I would see them, right? So you would have maybe somebody that was 20 years old that just got addicted to fentanyl, and the fentanyl disappeared because of the charge that they got faced with. They didn't have access to the fentanyl anymore, and then they gravitated to using heroin, and and that was then a challenge for that person to all of a sudden deal with that. And that was a pretty, and they were early on in maybe their addiction, and then you'd have somebody that was maybe a 65-year-old person that's been using heroin for 40 years.
Mhm.
And that, and those different motivation issues were present, right? And so each then person, you had to deal with their motivation differently. So,
Mhm.
and that willingness or not to change, and it was, and I had to adjust based on whatever level that person was at.
And when you're dealing with those motivations, what were there any techniques or skills, practices that you found to be helpful in kind of overcoming or working through those?
Sure. And, I know we have people from all different entities here, from, corrections to, um, to healthcare providers, to wardens, to medical, individuals. So, at least what I felt like it with this population, I'm sure it transcends across all of, our arenas here. But, I felt like the first, way to overcome a lot of maybe these barriers or this motivation issue was my relationship with them and my role with them. So at least the perception of a probation or a pretrial officer or a parole officer is the perception for a lot of individuals, right, that are involved in the criminal justice system. That I had to overcome that barrier first, right, and that they most likely felt like, okay, I'm just here to catch them, so to speak. So I had to really work on this, explaining what my role is and thinking through my relationship skills to overcome that, to really have them feel as if I was going to go along with them in this process, and I wanted to sincerely help them. And my role is, yes, to enforce the orders of the court, but my role also was to provide assistance and help, and hopefully get them to change their behavior and make them successful. So I felt like that was one key area. And then once I felt like if I established that, and we had this relationship back and forth, that would hopefully create this honesty, and it would create them feeling like those barriers were knocked down, and they'd be willing to talk to me, and they could if they knew that, okay, if one relapse happened, that it wouldn't automatically result in them getting back uh, in the court, and there was some level of trust there between myself and them.
Mhm.
So, and then we can work on the addiction, right, and then we can work on working with the provider. Then we can work on medication, and providing that opportunity for medication along with treatment. And then and I can keep going on, right? And so then it's working on an assessment to find out, okay, what is driving this, and what has led to maybe these behaviors, and then this ways to kind of hopefully make them successful. This assessment would give me some areas where they have some strengths, right, and
Right.
focus on those strengths, and working on involving different systems within their world, right? So if it's their family, if it's the community, if it's a medical provider, all of that, and have them be involved in the process. So um, and we kind of know in our world of um, things that are driving maybe behaviors, and that their thinking drives their behaviors, and evidence-based practices and all of those, and that their social networks are key, and dealing with those, and that could also help with hopefully their addiction down the road, and all those kind of things. So kind of a
Excellent.
long answer for
Well,
overcoming
it's a tough
the challenge.
subject, right?
Yes, it is.
Engaging
Yes.
motivation and changing
Yeah. Yeah.
motivation.
Yeah.
So are there any other challenges that you experienced in this work engaging?
Yeah, and especially with this, population, and one of the harder cases that I felt would come across is if somebody had chronic pain, and we would have them in the criminal justice system, right? And either, they again would kind of come in maybe at different points as far as their addiction. But, sometimes what we would see is that, somebody might have had some pain issues and then they were taking opiates as a result of that, and then it developed into an addiction, and then it developed even further. And so that now you have a criminal justice system that's involved that says, hold on, don't take the opiates because it's led to whatever we had them for.
Mhm.
And now we're dealing with this chronic pain. And how do we then involve the physicians? And that was difficult too, because the physicians sometimes were not as interested in my involvement, because they felt like their role was prescribing the medication and that was it. And then they weren't as involved with maybe a treatment provider if we had a provider that was involved, and bringing all of us kind of on the same page to potentially deal with this person that maybe has chronic pain but also has an addiction.
Mm, yes, yeah. And so what would you suggest, or how did you kind of work through that as you came, that issue came up?
Yeah, well, a couple gray hairs definitely worked through that as a result. But I think, and I hinted at this a little bit with just involving the physicians in the earlier comment around this community involvement, right? And I think this education piece, and I really try to reach out to the physician, right? And to have, a conversation with the physician about, okay, what's happening here? And then because a lot of times it was a physician and a treatment provider, and then they weren't always on the same page, and the physician didn't have time for me. And then the treatment provider was maybe not communicating. So I felt like trying to get all of those players involved
Mhm.
was critical, and then an education for that as well. And and another end to this too is just court education in addition to all that, right?
Mhm.
And the court being bought into this process of, okay, these are some of the things that are part of the process, and the medication is acceptable and is the best mode of dealing with this addiction. And then simultaneously we're going to be working on those things that are going to help them be successful, and providing the evidence-based modality of treatment, and making sure that the provider is also involved with that. And then and that there's this continuity of relationship between the provider and, so for me, being the officer that's supervising the person, and I really made sure that I made regular visits to the treatment provider. And if they were in inpatient treatment, I was going there on a regular basis, and that we were on the same page with what was happening, with the person. And then providing this, and if they were in an inpatient facility, making sure that we were setting them up for success after they got out. And you could probably argue the same for somebody that's in a facility, right, that's going to be coming out. And for those people in the corrections world that are listening here too, right? So this reentry planning, right, is critical, and involvement for um, for them. And I know there's some even Bureau of Prisons people that might be on the call, and if they're, a lot of times they'd be referred to a halfway house, and making sure that the staff at the halfway house were involved with the probation officer and the treatment provider, and ensuring this, so to speak, warm handoff once they do get back into the community. And then one other point I wanted to, just make with all of this chronic pain issue and challenge, and I know that I had to um, really learn this, is this tolerance, right, for all of this. And that the population a lot of times had manipulative behavior, right? And having acceptance, and that it wasn't personal, right? That if there was this, so to speak, manipulative behavior, that it wasn't a reflection on them maybe thumbing their nose at the system, but that they really do they really do had a problem, and that these were some of the techniques, and sometimes it was a long life of this manipulative behavior, and that's part of the process,
Mhm.
and that this is a disease, and that this tolerance aspect to it all, and it doesn't happen overnight, right? And that it takes time.
Mhm. Absolutely. So, as we're wrapping up today, if there was one key lesson you could say you've learned doing this work, what would you share with others who are in a similar space?
Yeah, I think I alluded to it right in the beginning, on the relationship piece and the role that you have. So no matter what it is, and the power and impact that you do have, that each individual has in that relationship piece, and don't underestimate that. And that creating this connection to people is, and I saw it. I saw it with probation officers and pretrial officers and parole officers, and I saw it with treatment providers, and I see it with physicians, right? Or whoever that don't underestimate this power of connection, and that you can have some impact on getting them to change,
Hmm.
and um, and that you never know when that can happen, and it's this kind of delicate balance then of still holding people accountable, but yet creating this space for people to be changed and supportive.
Great. Yes. Yes. So, thank you so much for taking the time to talk with us today. We really appreciate the work you've done and continue doing in this area. And so, thank you. Have a great day.
Thanks, Jen. I appreciate the opportunity.